those green shoots that she was talking about seem like a thing of the distant past right now when you look at these numbers, Andrew.
Yes, I don't think we'll be hearing the green shoots term for some while from the New South Wales Premier, Kieran. Death from 1,000 cuts in Sydney continues. A new day, a new high for cases and new restrictions. 239 new cases, a record for the state, including even the time last year when the international borders were open. If you're having trouble keeping up with the different rules, as Gladys Berejiklian changes them every day, you're not alone. From today, if you're in the following local government areas: Parramatta, Cumberland, Blacktown, Canterbury, Bankstown, Georges River, Fairfield, Liverpool and Campbelltown, you cannot travel more than 5 kilometres from home for shopping or exercise, and you must wear masks outside. Anywhere else in Sydney, you can go 10 kilometres. It's just more of this dribbling lockdown approach of Gladys Berejiklian. Restrictions for some areas that have to expand as the cases do. Restrictions that scale up and up and up. So I asked her if she's failed in not coming down harder and quicker on this outbreak.
With these numbers today, will you admit that your strategy has failed? That you have failed? Sorry, if I can just finish. And you said the settings were right. That's not true. And National Cabinet's going to decide it was a short, sharp, hard lockdown was the way. Can you see now that you've made a mistake there and the strategy is failing? And this death of 1,000 cuts, a little bit of restrictions every day just isn't working. You have to come down hard.
Well, we have harsher restrictions in place than any other state has ever had. And even if you look at mobility data, which we have access to, the vast majority of our citizens are actually doing the right thing. If you compare our mobility data to when Melbourne was in lockdown, the vast majority of our citizens are doing the right thing. But as we know, the Delta strain is a complete game changer, and it is so contagious. And we also know that it only takes a very small number of people to do the wrong thing to cause ripple effects, which can cause a setback.
So you haven't failed.
And of course, all governments are making their way through the Delta strain around the world. There is no perfect way to deal with a pandemic, and we've been far from perfect. And I would have made that comment 18 months ago. We've been far from perfect. But if you look at other places around the world and the way the Delta strain has taken over communities, even when vaccination rates have been much higher than ours, we can take some comfort in the fact that today we haven't had thousands and thousands of cases, thousands of people in hospital and many more deaths. And that's what these lockdowns are about. It's about preventing that severe illness, it's about preventing death and keeping the community safe. And once our vaccination rates go up, obviously then we can consider the way forward. But it's really important for us to acknowledge that had we not done what we'd done in the last 5 weeks, the situation would have been far worse. And I'm never going to suggest we get everything right. I don't think any government around the world can say they get everything right because there's no rule book. And I'm the first one to admit at every stage of the process in the last 18 months, with the benefit of hindsight, it'd be wonderful to know what the alternative course is, but we will never know that. But what I do know is that compared to other places in the world, as difficult as it is now, we've kept thousands of people safe and thousands of people healthy, which otherwise would have succumbed. And as Dr. Chant, Minister Hazzard and myself and everybody in the team says every day, the vaccines are working. The vaccines work. Touch wood, I'm yet to be advised of anybody in intensive care who's had both doses of the vaccine.
Berejiklian warned of higher case numbers in days to come. And she should know those figures are up until 8 p.m. last night, that 239 figure. New South Wales Health must have some idea of tomorrow's figures before this press conference held at 11 a.m. today. Now, my information from within the New South Wales government is that Gladys Berejiklian was advised months before this June outbreak that the Delta variant was far more highly transmissible and may need a different approach to past outbreaks. She avoided my question on when this was.
When were you first advised this year of the virulence of the Delta strain? When did you receive that advice?
I can't give you the exact date, but obviously we know that the Delta strain is far more virulent than any other virus.
Given the damage this outbreak and long lockdown are wreaking, the decisions behind it may well be worth a commission of inquiry like Victoria's when we're eventually out of this mess. Then Premier Berejiklian attempted to claim today that New South Wales has the toughest restrictions in place in the country. I interjected here to say, but there's no curfew. And the Premier justifies her statement by saying there are less essential workers on the list that can travel to work than in Victoria.
The numbers will keep going up until we change things, and that's why reducing activity, reducing mobility, increasing compliance, these harsher measures are the harshest Australia has ever faced in our lockdown. Can I make that very clear? These are the harshest measures any place in Australia has ever faced, but we need to do that. Because we need to do that. But based on the health advice, our list of critical workers is the shortest that any state has had. The ways in which, the reasons why you can leave your house is as strict as it is for anybody, anywhere that Australia has seen. And that's what we need, because the Delta strain is different to anything we've seen.
I guess it's all debatable. In Melbourne, there was a curfew. In Perth and Queensland, you had to wear masks outside everywhere.